Hello, guys. Hello, welcome back to my channel. Today we are talking about something really special, something really great. I think you can see from our live session today. The the stuff it's really important for us to start looking at these things because most of you have applied. You have applied to study in Finland, and importantly, we have to start addressing the entrance examination, and this is like a review on how the entrance exams in Finland look like. So you don't want to miss this. You want to join me live. Let's chat. Come on live, guys, and invite your friends. Tell someone to tell someone that I am live right now, and we can start we can start diving into it. So guys, welcome. Tell someone that Carl is live. Today we are talking about the entrance examination stuffs in Finland. That is our focus for today. So and I'm going to dive into several aspect of these things. So and you don't you have to yeah you have to come live. Let's chat about this issue. And I have, of course, lots of I have a lot of materials that I've prepared for this live session. So join me live. Let's talk about this. So after applying to study in Finland, the next thing you have to do is to guarantee a study place by writing the entrance exams. And today we are talking about the entrance examination stuff in Finland. So join me live and stay tuned. You have to stay tuned so that we talk about these things. And like we always do, once you come live, please let me know who you are and where you are watching from. Please, so let us know. Let us know who you are and where you are watching from. Yeah, so first of all, I want to let you guys know that the application that was ongoing recently has officially closed. So the application was from the period of the 28th of August till the 11th of September, which 11th of September happens to be today. And the application closed just like a couple of minutes before I came live. So the application closed like 5 minutes ago. So if you do not apply, you have to blame yourself because I talked about all these things, all this why I reminded you guys about all the things that you about applying. So, and as you know, I always give room to for people or for my audience to join me live if they have some questions they want to ask. And yes, that's the link that I've sent. So if you have a personal question that relates to anything regarding application period, coming to Finland, studies in Finland, whatever, so you can use that link and join me live, and we have a chat on that. So you don't have to wait till the end. Of course, you can just join me live and let's talk on this. So yeah, I see people are coming live. So first of all, I'm going to give a shout out to those who are here live, and then we continue. So we have Judith. Hello, Judith. Hope you are doing good. Judith says she is watching from Dubai, UAE. Thank you for coming in. We have Stella from Uganda. Thank you, Stella, for coming in. And please do well to share the channel, of course, to as many people as possible. And also, please do like the video. Do like the video, and I will be happy to hear your comments. We have Christelle watching from Cameroon, so thank you for joining. We also have U-Turn. I don't know U-Turn what your name could be, but she says or he says he's watching from Sri Lanka. So now let's go into it because we don't have time. I'm not going to wait people to join. When they join, we can always go back and forth and all those things. So let's look at I'm going to share my screen now, and please do let me know if you can see my screen just by saying yes, you can see my screen, so that I know that what I'm sharing you are able to see. So yeah. So are you able to see my screen? Please, can you just leave a comment and say by just saying yes, so I know that you are able to see my screen. Um, so I put this in presentation mode. Okay, it shows people are able to see my screen. So, like I said, and like you've seen, the name of the video, the title of the video is Nursing Entrance Exam 2024. So, I'm bringing this video really timely and now because the entrance exams finished today. The entrance application period ended today, and the next thing which you have to be doing, if I were in your shoes, was to start thinking, hello, how am I going to proceed with getting the admission in Finland? You all know that the admission process goes like this. After applying, you have to write the entrance exam, and after the entrance exam, you have to, if you are part of those who have been selected, you should of course be invited for the interview, and after the interview you would have the chance to now have the final result, which is the entrance exam, so the admission letter. So like you can see, I prepared this, the nursing entrance exam for 2024, presented by Carlson. For those who don't know, I am Carlson. I do content in regards to coming to Finland and nursing in Finland in particular. So let's go to the next thing. So when you think of the entrance exams, I'm starting this one with mathematics, because mathematics is one of those areas whereby people find it so difficult to navigate, to get their way around it. And usually a lot of people who contact me say they want to study nursing in Finland, they always say that, hey, my problem is math. But today I came out with these things just to show you how it is. This is you If you master these things, know that you have the entrance exam sorted. So it's like this. So let's go to the maths, like I'm starting the presentation with. So they usually ask questions like, how you have to convert, sorry, you have to convert from something to something, and please, you can do well to stop me in case there's something you want me to explain more, or you want more light on it. Do well to ask your questions. This is a live session, so do well to ask the questions, so that in case something isn't correct, you can put your hand up and say something. And of course, I want to hear your opinion. So now let's go to this. So the normal things usually comes like, for example, they say convert the following. So you always have to know how to convert from G stands for gram and mg stands for milligram. Okay, and this means that you can be given a question like, okay, 0.05 gram to milligram. How can you convert 0.05 gram to milligram? You understand that gram is 1000, and milligram is 100. So you just have to, like, simple mathematics. You just have to, since you are going from uh, big to small, you also have to understand that in this question, your answer should be bigger than 0.05 gram. It means that if you are living from the big amount, which gram is, and convert it to milligram, it should be like, you can just say 0.05. uh, I'm going to open my calculator as well and do it with you. 0.05 times uh, 1000. So 0.05 gram is going to be 50 milligram. And how do you get this? You just take 1000 because this gram is 1,000, and for you to convert gram to milligram, you have to take whatever sum is given times the sum. So in this case, is simply 1,000 times 0.05, which means that it is 50 milligram. It's just as straightforward as that and nothing complicated. So, like the next question also says that is 0.025 liters to milliliters. This is really, really similar to what I actually like the first one. These are kind of really same kind of things whereby they say 0.05 liters. You know that liters is actually 1,000 as well. So you just say 0.05 0.0225 times 1,000 is going to give you the answer in milliliters. So you will just say, I'm doing the calculation as well to see the answer 0.0250. You have to be careful with the zeros as well. 0.025 times 1,000, it gives me 25 milliliters. So 25 milliliters is the same as 0.025 liters. So it's as simple as that. And then we come to the next one, which is 1,575 microgram to grams and mk. So if you is it mk or mik? No, mik, sorry. So it's micrograms, usually grams to milligrams. So if you are converting microgram to, so this amount, do the reverse and calculate the other one. So like now we are converting to 4,000 milligram. So we have to just count 1, 2, 3 zeros behind. So it's actually simple. Like I said in the first one, you multiply 0.05 times 1,000 to give you milligram. In this case, you now go the opposite. So they say 750. You just divide by 1,000, and it gives you 0.7 grams. So it's as simple as that. I hope we are understanding this thing. And in case you have a question, please just raise your hand up and ask. And if there's something you want to join me live to talk about, of course we can do that as well. Let's go to the next question. So the next one is actually a scenario. They usually bring scenarios whereby the patient has been prescribed a certain amount of drugs for you to kind of administer to the patient. Sometimes these drugs are not in line with what is in stock. So for example, a patient is prescribed 0.25 milligram of digoxin orally once a day. So the patient has to take this 0.25 milligram of this tablet. You don't have to worry about the name of the tablet, but just know that it's like this one says a tablet. So orally, PO means, usually they will say orally or PO. PO means it's through the mouth, so it should be a tablet, but they'll always specify anyway. So they say, how many tablets should you give? Okay, they say in stock they have just 250 microgram. You understand? In this case, they are now saying that the stock they have is 250 microgram of tablets, but you have to give the patient 0.25 milligram of tablet per day. So now there's a contradiction here. You have a tablet, the doctor has prescribed something in milligram, and you have your what is in stock is in microgram. It is quite confusing sometimes, but it's so easy for you to know because that's why we started with converting. Now you can just simply convert 250 milligram to microgram, or you can convert 250 you can convert 0.25 milligram to microgram, or you can convert 250 microgram to grams, so that you to milligrams, so that you have a similar So they are all in milligrams or in microgram. So in this case, I can decide to say, okay, maybe I'll convert 250 micrograms to milligram. And by doing this, I'm just going to take 250 micrograms divided by 1000. I'll get I'll get 0.25 milligram. So it means that for me, the answer here is quite simple. They say, how many tablets will you give? So it means that you have to give the answer in tablets. So the answer is very simple, and it's just going to be one tablet. See, the reason is because you have 0.25 milligram of tablet, which is available, which the doctor has prescribed, and the tablets are in microgram, 250 microgram. So it means if you convert 250 microgram to gram, it's going to give you 0.25. It means that you should give the person one tablet. So the answer will be one tablet. And never forget, you have to write don't just write one, because if you write one, you're going to fail, because one word, one syringe, one word. You have to always specify one tablet. So sometimes they give you the short form of tablets to put there, or sometimes you have to put it in full. One tablet, that is how it is. We go to the next question. You have this one that to administer 400 microgram of folic acid, so daily, how many milliliters should you give? So you have to, like the previous one, just convert them to a similar something. This is a microgram. You can now convert it to milliliters so that they are all in the same, and you continue like that. It's quite simple and straightforward, just like the previous demonstration that we did together. Are we moving? And here also is also a similar question. I want you guys to familiarize yourself with this. This is a recorded video. After the live stream, you can always go back and watch it over and over, so that you get yourself familiarized with these questions, so that during the exams you are very confident of what you are doing. Because I kind of noticed that most people pass the other sessions and fail the mathematics. That's why I started this presentation with the math area, because lots of people are confused with the math thing. Some people are saying I'm not good at math and all those things. This is not math. This is just basic conversion. This is just basic understanding of how tablets and all these different kind of stocks operate. So those are just the important things that you have to keep in mind. Okay, the next one says that to prepare 62.5 microgram of digoxin. Remember, we had digoxin as a tablet, and now they say intravenous, which means that it goes as IV. How many milliliters should you give? So it's just as simple, like I said. You see, there is 60. They said 62 microgram of digoxin. This now, when they say intravenous in nursing terms means IV. So it goes through your veins or something. So in this one, there is the thing is in 62.5 micrograms. It's in microgram, right? And what we have in stock is 500 micrograms in 2 liters. So how many liters would you give to the person? So if I have to calculate this, what I'm going to think is that I'm going to like think, how many liters should I give this patient? First of all, there is 500 micrograms in 2 liters, right? 500 in 2 liters, and I have to give just 62. So how many liters should you give the person? Is there anybody live that wants to Is there anybody here that wants to contribute? You want to solve this question instead of me doing it? Somebody should come up and tell me. So let's make it interactive as possible. Guys, this is a link. I'm going to send the link. Somebody should try solving this issue, this one, and then I can correct you guys, and then we move forward. That's the link. Simply copy the link and oh yes, copy the link, and you join me live so that we can talk. You can give me your opinion on how you think this can be done, and then we are going to unanimously, or we can look at it and decide that which what is actually correct. So this is like a life lesson, and I think that is good that I make it as interactive as possible. So is there anyone who wants to come up and share what he thinks, or he or she thinks about this? Come on, don't don't be the student who always stays behind, who knows everything but doesn't is so shy to say, to kind of give your opinion in the or rather say the answer. We are not in a classroom. If you are wrong, it's not a problem. Always the student who shares his or her opinion learns better than the one who is so quiet in class. So is there anybody who wants to pick up the challenge and come up live and talk with me in regards to this? If nobody wants to come up live, I will just continue with what we were doing, so that we don't I don't plan to be live for long today. So let's continue. Where is my screen? Okay, here. Okay, so anyways, I'm going to continue. The next one is the English language issue. So the English is always, please, I'm seeing lots of people live. You guys, please do well to like the video. It doesn't cost you much to share as well to people and put it on your status or something. The next thing that I want to talk about is actually the English language issue. So I just came up with some things that is usually the problem why people don't understand, or why they don't pass the English language session, despite learning English all your life in school and everything. Some of us still face difficulties with this. The problem is that you are in English. What happens is that they are going to give you a passage, right? That you should read this passage, and the answers are below. So you have to I wrote there, first thing, you have to be a fast reader. You don't have time to go into detail everything that is there. I actually wrote it. You have to be a fast reader or a scanner. So a scanner means that you are just using your eyes and going through, but you are picking up important issues that you are seeing that are found in that presentation, or in the topic that you are exploring. Okay, so you are just scanning. Let's say they're talking about the health in Finland. The health population in Finland, or the population in Finland, has been reducing because there are like low birth rate and all those things. What you can just be doing, just scan. Okay, the population in Finland is reducing. What's the reason? Low birth rate. Okay, is there high death rate in Finland as well? So that's how you just scan through the whole thing and just have overall idea of what it's saying. You now go quickly to the questions. You just scan again. Okay, what's the question? Oh, you can remember. Yeah, I saw this somewhere here, and then you can just go and see the things that was said in that area, and you just copy and paste, copy and paste, copy and paste. So the first thing you have to know when it comes to English language, this thing, is that you have to be a fast reader and you have to be a scanner. You understand? You don't have time to read everything in that passage, because the passage is going to be quite long, lengthy passage. Some, they always talk about something in Finland regarding health in Finland. Sometimes they talk about the WHO, they talk about COVID-19, how it has affected people and all those things. You have to just be fast. You have to be fast. You don't have time to go through everything. Then the second thing, which is quite important, is you have to know what are synonyms. Okay, synonyms means that they give you a word, and you have to give a word that kind of means that has a similar meaning to the word that was given. For example, I don't know, nothing comes to my mind now, but synonyms is, I think, it's as straightforward as that. Just a synonym is just another word for what has been asked. So and then anonyms is actually the opposite. So if they said somebody went, and you know that the opposite will be somebody came. So something like that. That's how the stuffs work. And then they have critical thinking. They give you a small kind of passage or something for you to think about. You have to wonder about something and give a good precise opinion, which means that you have this is your own opinion, but it should be related to the topic and the whatever question they're asking. So these are the kind of things that you should keep in mind when it comes to English language, because they have English language. Um, there's a English language. There's a mathematics, and the other parts. So let's go to the other parts. So there is the ethics. One more important, something which is so important here in Finland when it comes to nurses is ethics. Ethics is are just as important as your job. I think it's even more important than your job here in Finland, and I think in most parts of the world, whereby ethics is gaining so much ground. And there's something that when it comes to ethics, there are many things that you have to think about. The first thing is we talk about, or what I think, or which will be tested you'll be tested on is confidentiality. There's something which once your patient comes to you, your patient is confident that you keep everything that the patient says to you. You wouldn't carry the patient's information or stuffs and share it out there. So that's something that is very important. And in the ethical part, they might ask you a question that a patient comes to the hospital, and she has so and so diseases, and after working with her, you were discussing with your sister, and you were sharing information about that person's diseases, and you were discussing about it. Is that ethically correct? That is vehemently very wrong. You cannot talk about patients things to even your sister or whoever. In fact, as a matter of fact, you cannot even share the patient's uh, uh, um, things even with your colleague that is not taking care of that patient. So if you are working in a ward whereby you are like 20 of you or 10 of you in that shift, and your one of your colleague, it doesn't she is not the one handling that patient, so you don't have any right to even share that information, what you know about, to the other patient, except maybe you're going on break and something like that, that you want somebody to back up, and then you can just say some few things about the patient to the other person so that the person can have an idea of what is happening with that patient. So the next thing is privacy. Privacy is as important as well. Just privacy is sometimes confused with confidentiality. Privacy means that the patient's name, the patient's social security, the patient's ID, you keep them private. You don't you kind of know that all those things are their privacy, okay? And of course, the patient's body is his privacy. For example, you are not allowed to take a picture of a patient with your mobile phone. Those are because we don't know where that mobile phone, that picture is going to. Are you going to bring it to social media? That is means that you are mitigating privacy. So all these things are the things that are going to be tested. They'll ask you a question like, okay, um I don't know how I'm going to phrase the question, but I think that they frame the questions in a way that you understand that this is privacy and you should not do that. Another thing is documentation. In Finland and in most parts of the world, if you're a nurse, anything that you don't document, it means that you do not do it. So, for example, they're going to say that, okay, you took care of a patient and you gave her so and so medication, but you forgot to write the medication. Is that ethically correct or not? That is very wrong. So these are the kind of questions that are going to ask you. You have to think about it. So documentation, you have to know that during the exam, anything that comes to documentation, know that anything that has not been written has not been done. So you have to always claim and put it forward to the examiner that you are going to always write everything that you've done in terms of taking care of a patient and in terms of reporting. The next thing is respect. Respect is very crucial, especially when it comes to nursing. Sometimes we nurses we get abused and all those things because we understand that sometimes patients come to the hospital and they are in a very bad mode, in a very bad shape. And when they start throwing some words at you for you to start throwing the words back at them, it means that you are not a professional. that's just what it means, because you should understand that the patient is doing that because of their mood and everything. But I'm not giving the right that because you are a nurse, you should be insulted at. I'm just telling you that you have to answer the questions in a way that shows that you will be respectful to your patient. If your patient says that I don't want this, you cannot force the patient, because that patient is a human being and you have to respect the patient's right to self-determination. So there is what is called self-determination. You have to respect that, because the patient is a human being and he or she has a right to say, I'm not going to take this medication, and you don't have to force the patient, hey, you must take the medication because the doctor said you should take this medication. It doesn't work like that. You have to respect self-determination. Okay. And the next thing is trust. You have to build trust. You have to show that you can build trust in your patients and everything. So these are the kind of things that will be asked in the ethical section. And let's go now to no, we have the reasoning skills. So you are going to have a situation whereby they'll ask you about reasoning skills. So in this area, what they are focusing on is how you apprehend things. Let's talk about this one. I don't know. Well, this one just simply means that how you put things together. You come to work and you have been given or let's say you have been given maybe like three clients. Okay, you have three patients to work with today. How do you prioritize? How do you categorize that? Okay, now I have to start with A, and then I'll go to B, and then I'll go to C. How do you apprehend? How do you organize yourself at work? Because if you have been given, let's say, three patients to work with, I'm not sure there will be somebody running behind you say, hey, you have to go to this man first and all those things. You have to read the person's care plan. You have to understand that, okay, this patient, I'm going to start with this patient because this patient has so and so and so and so things that needs attention. You are going to do this. So that is what, yeah, that is what it's very important. This one is very, very, very important as well. You have client prioritization is also kind of similar with this. So you have to know how to prioritize, especially when it comes to your clients. You have to know that this person needs more time, this one needs more attention, and all those things. Okay, then the next one we are going to talk about is work dedication and division. You as a registered nurse, you have a key role to play, because in that department there might be practical nurses and there might be oral caregivers. So you have to know how to dedicate work. You have to know how to do work, what's called work division. You have to know who is capable to do what and at what time and all those things. And these are kind of things that they will be testing you in the entrance exams as well. So timing, for example, you have to know timing. And of course, in Finland, you have to the timing. I also wanted to add a punctuality. Unlike in other places in the world, whereby people start work at 8 o'clock and they have to start work at 8 o'clock and they arrive at work at 8:15 or 8:10. That doesn't work in Finland. If you have to start work at 8, that 8 o'clock means that you should be dressed in your robe and you are ready to start your work. Not that you are signing in at 8:15 or 8 o'clock to go and change your dress. It doesn't work like that. You have to be ready for work at 8 o'clock. So punctuality is very important, and they will ask you questions on punctuality as well. So I gave an example here. I said, e.g., if four people take 6 days to build a house, this is like reasoning skills. How many days? How many? It was supposed to be days. How many days or how many days would 8 people use to build the same house? So these are part of reasoning skills. These are the things that you'll be asked on, or they'll want to know from you if you can answer this kind of questions. So that being said, what's next? What do we have here? Yeah, so those are the things. And so thank you for your attention. And if you have some questions, if you have some questions, please do also ask me now. This is the time to ask your questions. Yeah, and also you have to check your emails for some more examples, because usually they send some sample questions to your email. So you have to always be on your email, and you can, of course, get to me in case you have any questions or difficulties, and we are going to talk on all those things. Yeah. So if there's any question, you can ask me, and if not, we can continue from there. Is there any question you guys have? Like I said earlier, there is this link. You can use this link. You can use this link and get to me. If you have any question, or you want to talk with, or if there's something different you want to talk about, you can use that link and join me live. Let's talk. Yeah. Is there anything, any question? Those are, I'm sure all everybody that is like here live have, you remember to apply, and you you have all your applications ready, and so you can tell me about the school you choose, and let me hear your opinion why you choose that school, and how has everything been. Okay. Yes. Stella says, yeah, concerning studying medicine in Finland. Yeah, actually, there are many schools in Finland where you can study medicine, but the issue is that most of those courses are in Finnish language. So you are required to have some level of Finnish language in order to be part of, or rather for you to study medicine, you need some level of Finnish language. So I will advise you to first of all study Finnish language, and then you can continue from there. But that's usually the path towards studying medicine in Finland. And also, what happens is that um, most students use the nursing route, so that after studying nursing in Finland, they have a good base, and then they can now, and of course, by the time you graduate from a nursing school, you should know some level of Finnish language, and then you can now continue with the medicine. So that's the route that most people usually use to study medicine in Finland. So I don't know if that could be something you want to try, but I will advise that that will be something good for you to try. Yeah, hello, Madam Chioma. I think are you just joining? Were you able to grab all these entrance exam stuffs? I did a presentation whereby I started with with these things, like I shared this info on all the things, all the materials you need. I started with the mathematics, then went to English and all those things. So if you are not here, you can just go to the video and kind of and just watch it, because I explain all these things, how the mathematics exams look like, and all the kind of questions that you should be expecting for your exams. Okay. She says thank you too, thank you for joining me live today. I think the live session today will be probably a short one, because what I had in mind, I've already shared it. And if there's any question, if there's something, then you can ask. If not, then I would say have a blessed day then. Is there any other question? Anybody has something to ask? Any concern? Yeah, the entrance exam dates. Just just keep your emails active as possible. Check your emails as often as possible, because the entrance exam date and everything in regards to the entrance exams will be communicated to you to your email, and you can of course uh, um, save those dates so that you have your entrance exams and everything's sorted out. And remember, you need your laptop. Don't use your phone to write the entrance exam. Remember, you need your laptop, you need a quiet place. You are not to share the information with anyone. Nobody has to write the entrance exam on your behalf. You have to write it by yourself. And yeah, follow all the exam rules that you have been taking exams wherever you are. Taking exam any part of the world is the same. So yes, you just have to follow the exam rules and do everything that 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 you should do in regards to safe exam practice and all those things. But that being said, thank you guys for joining me live today. I don't have anything more to share. Um, and see you guys in the next one. Yeah. Any other question? You turn from Sri Lanka. I don't know if you have a question. Well, if there are no more questions, we'll leave it for that like that today, and I'm going to end the live session at this point. So thank you once more for coming. Please do subscribe if you haven't subscribed. Please do share my channel to as many people as possible, and of course, do like the videos and leave some comments on how, and maybe feedback on what you think about the presentation, so that we can make it better next time. All right. You take care and have a lovely day. Bye.